Okay, make a start now. So, thank you again for everybody to come to this session. It's the first session of 2013, and again, Happy New Year, belated Happy New Year. So, those of you who don't know me, my name is Diffin. So, I'm going to mute everybody for the moment. I'm getting a bit of interference, so bear with me. There you go. Okay, what was I saying? Yeah, so, this is the first session of 2013, so Happy New Year, belated Happy New Year. This is for those of you who are new here, this is a service that we provide to all our members on a monthly basis. So, for example, next month you'll be getting another session, and if you've got any burning topics, feel free to give me a shout. I'm more than happy to do something that you need. So, this is what we're going to be talking about. I'll say a couple of other house rules. I'm going to put you on mute for the moment, and I'll open up everybody if they have a microphone to have a chat at the end of the session. It's just to help me manage the time a little bit better. Second thing, it is going to be recorded, so if you do miss something, then have a look on the website the next couple of days. It'll be on there. And as you can probably see, the way in which I tend to do these things is to use a mind map system, which is what you can see in front of you. It just helps to visualize what's going on, as opposed to a very long and tedious PowerPoint presentation, which is I tend not to like them very much at all. So the structure of this, you'll see, will hopefully work a lot better when we work through this today. So anyway, again, let's make a start now. So today, hopefully, you've attended the webinar because you want to know something about how to question patients. And as counter assistants, and I presume majority of you are counter assistants, it's a very important thing, an important skill for you to develop. And the next 20 or so minutes, what I'm going to be going over with you is some systems that are out there to help you deliver the best care to your patients. And there are a few mnemonics. I'm just going to open this one up just quickly that you can use. There's a WHAMM, the ASMETHOD, there's a few other rather unusual ones, Sit Down Sir and Encore, which you can use. And then the one which I'm going to concentrate on more than anything else is going to be the WHAMM. These other three ones, as we'll come to learn about, tend to be slightly more complicated, and I've only really included these more for reference as opposed to expecting you to learn these. We're going over this one in a lot more depth over the next few minutes or so. So, first and foremost, what is it that we need to question the patients, just to set the scenery? A few reasons really, and the first few that come to mind is when you're recommending a product, it potentially be bad for patients. For example, I'll give you an example. If, say, for example, you recommend a decongestant to, say, somebody who's got hypertension or high blood pressure, that is, or possibly even cardiovascular disorder, some sort of heart disorders, it generally isn't a very good thing for the patient to have. And by questioning the patient, you can elicit the sorts of information that you need in order to make a proper decision, or if necessary, refer it to the pharmacist. But really, questioning, the first point I would make is that it's very important, because you could be recommending something which may not necessarily be good for that patient. So hence, this is reason why these sorts of systems have been developed for you to support you in getting the right sort of information out. So the second thing I would argue is this one here, which is to help support in the smooth running of the pharmacy. Now you can imagine that you're effectively in a position whereby you're the first contact for that patient in that pharmacy. You can imagine having to run in and out of the dispenser every so often to get an opinion from the pharmacist, and then go back and ask the pharmacist again, and then go back and ask the patient. It doesn't work very well. And also, it'll probably tease a pharmacist off quite badly as well. But not only that, but it could actually end up causing a dispensing error as well, because the pharmacist will be disturbed all the time. So in order to get the right sort of information out and then make a decision as to whether or not you recommend a particular patient a product or whether or not you refer it on to the pharmacist, a good questioning technique is needed. So not only will it actually help with basically a smooth running of the pharmacy, but it will also eventually even help you help reduce any sorts of errors or reduce the error rates in the pharmacy by not having to disturb the pharmacist all the time. A third one, which is quite an important one, but is missed quite a lot, is that it also makes you appear confident to the patient as well. 90% of a consultation is how you deliver the information. It's not what you deliver, but how you deliver it. If you deliver it in a very meek voice and really not very confident in yourself, it doesn't inspire confidence in the patient. So what this will do is it will give you a system whereby you can then hopefully start to appear a bit more confident to the patient, and hopefully it will improve your self-confidence as well. So these are generally the main reasons as to why you'd want a good question. I'm sure you'll be able to figure out more by yourself as well, but these are the main ones which I've come up with. Now, let's move on. By the way, if anybody has any questions that you want to ask, there is a text box. Here, let me just type it here. If you've got a burning question that you want to ask, then type it in there for the moment. You should actually have a little chat screen there, and I will try and answer it. So let's go on to the next one. When is quite there are two main different types of questions that you're likely to be asked. The first question, the first thing that you're likely to be asked by a patient, or one of the first things you might be asked, is what we call specific item. And an example of that would be a patient asking you, "Good sir, can you give me a packet of Nitol?" or something like that. But it knows what they want, they're just expecting you to give it to them. The second type of question, which is probably the more complex one, which is this one here. You might not necessarily be able to see it because it's in red. I've actually put it in grey as well, which doesn't look very good. You're actually asked to recommend a specific product. So, for example, it could be something along the lines of, "Good sir, I'm having trouble sleeping at night. Could you recommend me something?" So you can see for yourself there's two different types of consultation that you're likely to experience. One, which is where the patient asks specifically for an item, and the second one whereby you're going to be asked to recommend something. And these mnemonics tend to be more specifically for this particular type of interaction. So in other words, these mnemonics that I'm going to show you tend to be more for when people ask you to recommend something. I'm going to go into this one in too much detail today. That's going to be for another webinar. What we're going to be talking about now is, let's say, for example, let's come up with an example, which is a patient comes up to you and says, "Good sir, I'm having trouble sleeping at night. Can you help me?" Okay, so let's concentrate on that as a query. Now, earlier I mentioned the mnemonics. There's different types of mnemonics that are around. A mnemonic is basically an easy way to remember something, and what methods actually are that they take the first letter of a particular prompt and provide you with information as to how to question a particular patient. So let's look at the most important one and the one which you're likely to use most often, which is the WHAMM technique. Yeah, you've probably heard of this, but there's no it doesn't hurt to actually go over it again. The WHAMM technique here employs 5 different types of questions. That's the reason why there's 5 different letters in here. I'm not teaching you to suck eggs, but that's the reason why. The first letter is W, which corresponds to this W here, and who is the patient. For example, the reason why this question is asked is that the person in front of you may not necessarily be the person who's going to be taking that medicine. It could be, for example, his grandmother, or daughter, or somebody under the age of 16, or somebody else. So it's important to establish who that medication is for. Second one is, what are symptoms? In other words, what are you feeling at the moment? Obviously, this particular patient is feeling insomnia, as if they've got insomnia at the moment, and we'll go into that in a moment. How long have the symptoms been present? In other words, is it just a temporary thing? Has it happened just over the last few days, or has it happened over the past few months, or year, whatever? An example where this would be quite important would be, let's say somebody comes up to you for a cough and say, look, I've got this really bad cough. I've had it for over a month and a half now, and it's not shifting. What do I do? Can you give me something for it? Normally, we tend to recommend after about 2 weeks you tend to see the doctor. So it could be something a little bit more serious. So that's the reason why a question like that is actually quite an important one. The next one is the A, which stands for action. And this particular question relates to the sorts of actions that you've already taken, or the patient's already taken, in order to support themselves. So in the example of a NITOL, for example, the patient may say to you that they tried a double remedy which hasn't worked. So obviously you don't want to give them something like that again. Or it could be, for example, that they haven't tried anything at all, in which case that could be just as useful, a bit of information as well. So that's something that could be quite useful one to ask them about as well. The last one in the WHAMM technique is medication. So in other words, it's very important to ask them, what medication are you taking at the moment? Or this person who's going to be taking it is taking at the moment. It could be something as simple as they're not taking anything at all. It could be that they give you a whole list of 50 medicines that they're taking, in which case you're probably going to need to talk to the pharmacist anyway. These questions are probably going to be the most commonly used ones that you, and in actual fact, probably the only ones that you will be using in the pharmacy, and they are brilliant. They will extract practically all the information that you will need in one go. Let's give an example. I mean, earlier on we talked about that patient who wanted NITOL. So, for example, on the patient, I say something along the lines of look good, say good, sir. Anyway, I'm having difficulty sleeping at night. I've recently just started a new job, and I'm having trouble adjusting to the shift work patterns. Is there anything that you can recommend to me that I can use to actually just help get my cycle back to normal? So in this particular example, there's a few questions you probably won't need to ask. So, for example, I've already established that particular issue is with this patient, because he's already said I. So you don't ask this question, do you? For example, you already know what the symptoms are. This guy's actually feeling insomnia at the moment. He's sleeping. What you don't know is these three here. So let's ask these questions. So, for example, you would then ask, well, okay, then, how long have you had the symptoms? And the patient says, well, I've had it for about a week or so, just until, I started this new job. Shouldn't be a big problem there. So what sort of actions have you taken? Well, I've tried some herbal remedies. I've tried the herbal NITOL, really hasn't worked. I've tried some sort of valerian extract. Again, that hasn't really worked. I need something a little bit more powerful, just, to help me get to sleep. And the last question would be, well, okay, what medication are you taking at the moment? And he would say something like, I'm not taking anything at the moment, so that shouldn't be a problem. So in all, you can then make an assessment of this particular patient. You can probably figure out that this patient shouldn't have a problem taking NITOL. He's not taking anything. He's had a few things, and they're not serious things, but he's tried a couple of things which haven't worked. He's had the symptoms for a reasonable period of time, about a week or so it's not too long. And it appears that there's nothing sinister about the condition this particular patient is asking for. In a particular situation, I probably wouldn't have any hesitation in recommending the NITOL to him, in which case I'll sell it to him and say, and give him the cautions relating to it, saying, does make you drowsy, obviously don't take it with alcohol. Don't drive with it, especially and those sorts of things you'd want to explain that to the patient. So you can probably now figure out how important these questions are. Who is the patient? What are the symptoms? How long they've had them for? The action taken, and then medication being taken. Let's change this situation slightly now. So, for example, if I were now to say in the last question here, just highlight this, that the patient is taking something. Let's say, for example, they're taking a drug called, let's say, trazepam. Now, nitrazepam, for those of you who know, is quite a long-acting, it's actually a long-acting benzodiazepine. It's a drug which actually helps people to go to sleep. So this particular patient is coming into the pharmacy. He's already got something quite serious for insomnia, and he's asking for something in addition to that. In this situation, you probably would not want to give him the Nitol, and you would want to refer them onto the pharmacist. You can see from this particular method, you've been able to establish whether or not this particular drug is suitable for the patient, or whether or not it needs to be referred on to the pharmacist, in which case they can make the decision after that. Hopefully you see now that this particular method is one of the best that's available. I would highly recommend that for most situations something like this would be more than sufficient for your needs. Now, I've included a few more for your reference than anything else. It's not something that I would expect anybody that I work with to know about or to or use on a regular basis. But and also most of these methods are variations of the WHAMM method, and I'm not going to go into it in too much detail, but I'll go over it with you in a very brief manner. So another one is called ASMETHOD. This takes into account a variety of different things, and you can probably see that quite a few of these are also explained in the WHAMM technique. So, for example, you've got the S, which is the self or someone else, which is the same sort of question as you'll be asked in the technique, who is it for? You've got another one here, which is extra medicines and the medication you're taking. Again, that would be the M in WHAMM. Time persisting, that would be how long did you have the symptoms for? Other symptoms. So a lot of these sort of questions that you ask that are on these are the same sort of things that you'll find in WHAMM. You have a couple of others. You've got the age and appearance, and an example there would be, let me give you an example. So, with the Nitol example, that is actually in fact a drug of abuse. You're very unlikely to give that particular patient Nitol if they come into your pharmacy drunk and possibly on drugs, whatever. So this particular questioning technique also takes into account that as well. It also takes into account danger symptoms, and we'll come on to that on another webinar. I'm probably going to be doing another one next month on danger symptoms. So, for example, somebody comes into the pharmacy with a cough that's been going on for more than about a month and a half. That's a danger symptom in my eyes, because it could be something more serious. For example, they could be coughing up blood or something like that, in which case there's an immediate referral. So this method also takes into account that, but you can probably understand that the WHAMM method is a lot easier. It's only got 5 things you need to remember, and the majority of things are taken into account anyway. I'm really just going to flick through the remaining 2 of them. There's another one called Sit Down, Sir. It's quite a nice little mnemonic. I'm sure you can remember that one. As you probably see, there's a huge number of things that are that are found in this one. And this one tends to be used in a full-blown consultation. So in other words, for example, a doctor may use it. You may even use it in A&E or anything like that. And it's a very good way of getting very clinical symptoms. So, for example, the site of location, the intensity and severity, the time and nature, duration, the onset, and you've got a whole other number of things here as well. So this, I certainly wouldn't recommend it as a first line in the pharmacy. It's very much clinically orientated, but still it's a good one to know about as opposed to use on a regular basis. The last one again is called Encore. Again, similar sort of thing to explore the symptoms, make sure they've got no medication, what care they received, what can you see going on, and if they've been referred, and to explain the condition. So again, something generally sort of recommended use in the pharmacy, but it's just worth bearing that in mind. But above all, I would recommend use the WHAMM technique. It's the easiest to use. It is something which will support you in your pharmacy. It will help the pharmacist, and it will also give you a huge degree of confidence as well to go out and speak to patients and get that information extracted from the patient to your pharmacist. Okay then, so that believe it or not, is the majority of what I wanted to talk about. I do have some time left over. I actually set aside about half an hour today. We're hitting 11:24 now, so I'll open up the forum now. So if you've got your microphones open, so I'll just unmute you. Does anybody have any questions that they want to ask in the meantime? Anything at all? If you are, you can quite happily type your question in as well. Okay, it doesn't look as if anybody wants to talk to me today. Okay, I'm not going to take it personally. Hopefully, then this has been a crash course in questioning that you'll then be able to take away with you. I will be putting this mind map out on the website very shortly, so in the next couple of days, please look on there if you've missed anything, and we will. Sorry, let me mute everybody. That's better. And you can download it at your leisure. The recording of this presentation as well will be put on the website probably by Monday next week. So if you've done anything, or if you want to go over it again, then by all means do that. In the meantime, if you do want to contact me on anything, my name is just different. I'm the head of professional services at the audition, and my number is 020-8863-3235. Feel free to give me a shout if you have any questions and that. So I'm going to close this session now. Have a really good afternoon. I hope everything goes well, and remember your WHAMM technique, and hopefully you found this very useful. I'm getting quite a few thank yous. Again, no problem. This is going to be a regular thing, as I said. So please come next one. I will. It will probably be on danger symptoms, but again, if you have any other requests, then feel free to give me a shout. Okay then, I will see you later, and have a good evening now. Take care now.
Thank you.
Bye. Bye-bye.
Bye. Bye.